Hello everybody, hi, I'm Jewel. Welcome to my channel. Today's topic is evaluation for a kidney transplant. And for all of us that have already had a transplant, these are the steps that we also had to take. And this is the steps that you will be taking when you get evaluated also for a kidney transplant. So this information is coming from the National Kidney Foundation. This is going to be a probably two-part video because it's a lot of information. So let's start. Many people feel that a successful kidney transplant offers a better quality of life than dialysis. I can say that as yes. To be considered for one, you must be evaluated at a transplant center. This is done to make sure that a kidney transplant is the best choice for you. The evaluation will be very thorough and may take several months to complete. You will meet with members of the transplant team, which may include a transplant surgeon, nephrologist, nurse coordinator, social worker, financial coordinator, and dietitian. Your transplant team will need to know a lot about you to help them and you decide if a transplant is right for you. How will the transplant center begin my evaluation? Many centers have an intake coordinator who will speak to you over the phone and start the process. The coordinator will get basic information and then send you a questionnaire to complete. Your insurance company will be contacted to make sure they will cover the cost of the evaluation and a transplant surgery at the center. If you are on Medicare, the transplant center will contact Medicare for authorization. The next step is an initial visit. You will meet with several people at the transplant center. They will discuss the transplant process with you and review your physical, psychosocial, and financial needs. The evaluation process can be exciting and a very busy time. You can best help with the process by getting all your testing done as quickly as possible. What does the evaluation involve? Each transplant center has its own guidelines for deciding if you are a good candidate for a kidney transplant. However, at every center, you can expect to have a medical and surgical history. The transplant team will review your medical history carefully. You will be asked about any illness, surgeries, and treatments you've had in the past. You will also be asked about your family's history. If any problems are found, they will be looked at further. A physical exam. The transplant team will need to make sure you are healthy enough for transplant surgery and that a transplant is the best choice for you. They will examine all your major organs and body parts. A psychosocial exam. Getting a new kidney has many benefits, but it also has some risk. One purpose of the psychosocial exam is to make sure you are emotionally prepared for the surgery, post-transplant care, and for living with the new kidney. You and your family may have some unexpected feelings during this journey. The psychosocial exam helps make sure you will be able to cope with the physical and emotional aspects of your transplant. Compatibility test. The transplant team will need to know your blood and tissue type in order to match you with a suitable kidney. A sample of your blood will be taken, and the following tests will be done. Blood typing. It is easiest to get a kidney from a donor whose blood type is compatible with yours. There are 4 main blood types: A, B, AB, and O. Everyone fits into one of these types. Although getting a transplant from an incompatible blood type is possible in some cases, it requires additional medical treatment before and after transplant to reduce the risk of organ rejection. These are known as ABO, incompatible kidney transplants. Tissue typing. This test compares the tissue within your body to the potential donor's tissue. A good match means it is less likely that your body will reject a donor's kidney. Okay, everyone, I'm going to stop right here and pick up the rest in the next video. But as always, we are always thinking about you, and of course, sending you so much love and care. And hopefully you are all doing well and taking care of yourselves. And always being compliant with your doctors. And always remember to stay positive. And I will see you on the next video. Take care. Bye.